up YouTube? Adam from C1Do1 here. I don't usually do morning videos, but here we are. It's just after 7 o'clock in the morning. I'm on my way to observe electroconvulsive therapy, or shock treatment, as some people like to call it. That term isn't used anymore. But yeah, I've never observed this before. I've worked with physicians who did do it, and in another country also, so... But yeah, I kind of have a rough idea of how it's going to go based on some YouTube videos I've watched, based on some readings. But yeah, I'll give you an update after I leave today's sessions, and then I'll tell you a little bit more about how electroconvulsive therapy is used today in practice. So stay tuned. And I'm back. So I just finished observing with the psychiatrist who does ECT. ECT was unlike anything I've ever seen, honestly. It's definitely a lot of sick patients, patients that have tried other treatments and have failed, but also some that are kind of on maintenance therapy. Those people that don't really know what ECT is. ECT stands for electroconvulsive therapy, ECT. Like I said, it was previously known as shock therapy or shock treatment. That term has fallen out of usage because it has a kind of a negative connotation. I'm sure some of you guys are aware of the stigma that surrounds the use of shock therapy from popular media, like One Flew Over the Cuckoo's Nest, and some other references in film and television. And it's nothing like that, and yet there's a lot of similarities still, though. So I say it's nothing like that because these treatments that are done in this physician's outpatient clinic are done under general anesthesia. In the room itself, it consists of typically the physician who's ordering the ECT treatment and then an anesthesiologist. So a patient will come in, they'll get consented, they have an IV started for anesthesia, and then they also have their vitals taken, and then they will have the anesthesiologist come out and kind of explain the procedure to them. They wheel the patient into a smaller area, and then the psychiatrist kind of explains the procedure to them. Anesthesiologist goes ahead and gets them ready and says, okay, I'm going to go ahead and give you some medications to make you fall asleep. You'll be groggy. And once the patient was confirmed to be sedated, then the physician that I was working with actually had the old school, the things that you actually might see on some of those pop culture references, which is why I was saying, on the one hand, it's kind of nothing like that because the patient's totally sedated, doesn't even realize what's going on once the treatment is occurring. Whereas all of the media references to that was oftentimes they were wide awake and they could feel and experience everything, and that's extremely painful, and that never happens. That's completely different. But then the way that the current is actually administered is using a machine that's plugged into the wall, and then it has two leads or electrodes basically, and they're handheld and they have a push thumb start. And so the nurse will, once the patient's sedated, the nurse will prime the machine, and then he goes ahead and then clicks one button, and then the patient's entirely monitored via EEG and a heart monitor as well. And the way that you know that a successful treatment was administered is by seeing EEG waveforms consistent with convulsions. So basically what ECT is it's what it stands for, electroconvulsive therapy. So it forces a patient into having a seizure, and it's that seizure activity that's administered to the patient that is shown to be effective in using neuroplasticity, which is the ability for the brain to kind of remodel itself in a different way to facilitate rewiring of the brain that will help alleviate symptoms of major depression, catatonia, schizophrenia. So the treatment itself actually only lasted no longer than 8 seconds was when the current was delivered. And during that time, the only way that you could tell that anything was different was sometimes the patients would grimace. They would clench their eyes, their mouths, and then occasionally their wrists would kind of turn in, which if anyone who's ever witnessed anyone having a seizure, it looks very similar to that. There's a bite block placed in the mouth so that they don't bite their tongue or they don't break a tooth or chip a tooth or anything like that. The convulsion itself lasts, I think the longest I saw today was maybe 60 seconds. So in total, the amount of treatment being administered is almost less than a minute long. And so then immediately after that, I go into a recovery area. Side effects, apparently headache is pretty common, which makes sense. Some people have muscle tension, but otherwise it's definitely a safe treatment, although it can seem kind of the stigma around it, man. Like the doctor that I was working with, he said anytime you have students or friends that want to come see this treatment so that we can remove the stigma, from this treatment, he'd be more than happy to do that. If you're interested in reading more about ECT, I'll actually leave a link below. They're kind of dated videos, but they're really, really accurate and really thoroughly explain the procedure itself. So that's all I have for you guys today. ECT, have you heard of it? What are your thoughts about it? It's kind of controversial. Honestly, it seems pretty safe, and according to these physicians, it's very effective. That's all I have for you guys today. I'm going to go relax for a little bit. My psychiatry shelf exam is actually 1 week from tomorrow. But anyway, I'm gonna go study for that. I still have a lot of studying to do. Hope you enjoyed this video. Let me know what your thoughts are in the comments below. If you like this video, subscribe. I'm gonna be posting more videos about my experiences, rotations, and different things to come. Follow me on Instagram @C1Do1. I'm Adam. Thanks for watching.